Well, I guess we can dive into a little bit more about what NKT is, since we're kind of already hitting that.
Yeah.
And I'll ask some more questions as you explain it a little more.
Okay. So I always tell people that neurokinetic therapy can essentially assess every single muscle in your body. So we obviously the major muscles, but I'm talking like jaw muscles, eye muscles, pelvic floor. And it can assess which muscles are neurologically overactive and which ones are underactive. So I always explain to people, and this is heavily from my experience with stroke patients, is our brain decided that there was a reliable, like I always say my core, for instance. If you test my core, usually it's one oblique that does everything for me. Sometimes it's a pelvic ligament, but all the other muscles are basically off. So my brain was like, hey, I've used this muscle time and time again. It's never failed me. Why would I switch? And then the other muscles kind of go, well, we're not really doing anything. We're just going to kind of chill out here. So even if form, because right, that was with an exercise physiology background and kinesiology, like we hammered form so much. Like I do know form really well. I have good form, but despite form, some of my muscles will never turn on because my brain's just like that muscle's worthless to me, essentially. So what makes it powerful is it finds which muscle to turn off, to relax, release, massage, however, needle, and then which muscles to turn on in relation. Because if we never turn on the inactive muscles, then the pain's just going to continue to come back, or the form, you know what I mean? Like they're just never ever given an opportunity to even try.
So does it basically help you kind of feel what the sensation is of turning on those muscles you don't normally use? So that, like,
Yeah.
say
Yes.
after we go
Uh,
in and work out, you have a better idea of like how to flex and utilize that.
yes. Like it's actually a really odd I think I actually told you when we first met. So I have two belly button scars, and so we do a lot of scar release too. Scars heal over arteries, nerves, so and that tight like collagen tissue just causes a lot of dysfunction. So I had no idea that my scars were actually turning off any ab workouts that I would try. But surprisingly, after I had my scar release done on my belly button, I love to do dance type classes. So I was doing Zumba, and I was like, I literally felt like I had an isolated core workout with Zumba because it was actually helping with some of the twists and turns. So it does feel different. Some people won't necessarily feel that. I feel like sometimes you just feel like I'm just more efficient. You know what I mean? Like when I'm lifting something, or like it just feels like it's not going to be sore later, or I'm just not using everything in my physical being to help me get through that workout.
So you talked about like the scar tissue release. Are there sometimes, because initially we talked about like the dysfunctions or stress just being like pain points. Are there ever times when maybe it's not necessarily like a muscular type of pain, but there could be another symptom or dysfunction that could be I guess, the result of some sort of you adhesion or
Pain.
something that you
Yeah.
wouldn't really attribute to, well, I'm not in any pain, but I have this issue, and it could actually
Yeah.
be both of that. So what are some of those like signs or symptoms that you often
Yeah.
see aren't
So I feel like I get a lot of people that just have like random whole body like stiffness, sometimes isolate, sometimes like just like whole body one sided, or like half body, I guess. And then sometimes they're like, it's just generally diffuse. Usually that means there's a bigger player involved. Like this week, I've been doing a ton of jaw releases. A lot of people who are teeth grinders and jaw clenchers. It's amazing how like these little small muscles in our jaw just kind of take over. So it like pulls on all your like fascia in your neck. So these people have like almost irretractable neck pain. Sometimes it even turns off some muscles in the back. So I would say stiffness is one. Sometimes even just balance. Like one of the craziest to me was I really thought I had a heel spur or some type of something that I needed to see like a foot doctor for. And I again just lived with it. It was normal. So I bought all the, random orthotics. And then when I was going through my training for neurokinetic therapy, they actually found it was coming from my inner thigh, which never hurt me. I would have never even massaged there, but just when people would put their hands on it, I was like, holy moly. So just that imbalance of inner and outer thigh was changing how I was landing on my heel, therefore causing this heel pain because my foot just was landing terribly every single time I would move.
interesting.